on R&D expenditure to 1.5% of GDP by 2020, and to grow this to 5% of GDP in the next 5 years. It's a very ambitious target which conference has set out with, they say, the intention to ensure that we increase South Africa's competitiveness and ability to respond to opportunities offered by the so-called fourth industrial revolution. Conference has also resolved that much more must be done to promote social and grassroots innovation in South Africa, that communities, provinces, local government must become far more embedded in the innovation system in order to use new practices, products, and services to enhance our responsiveness to the demands of development. There was also a resolution that we should intensify our public engagement programs to ensure that more and more of our young people and the community of South Africa are aware of the value that is inherent in science, technology, and innovation, and that they increasingly seek to derive benefit from this, as well as encourage young people to aspire to pursue careers in science and technology. There's also a very strong statement on the need to see a far greater affinity between knowledge production institutions, your universities and science councils, and the private sector in South Africa. There was a view from conference that this tends to be a very tenuous relationship, and in countries that are most successful at becoming knowledge-driven societies, there's a very strong link between universities, science agencies, as well as the private sector. So it was felt we need to intensify our efforts in this regard. I won't go through all the other general issues. On basic education, a very strong view that we need to intensify attention to rural education, that there has been progress with providing improved infrastructure, but there's a sense in which the advances are not sufficiently adequate with respect to infrastructure in rural schools, especially laboratories and libraries. So a very strong call that there needs to be improvement in this regard. There's also a view that we must intensify and expand the Funza Lushaka bursary program, because the conference is of the view we're not keeping up with the production of teachers at a number equivalent to those who are exiting the system. And of course, a very strong call that the Department of Basic Education must intensify efforts to improve literacy and numeracy within the school system at all grades, but most particularly at the foundation level of schooling, with recognition of some of the gains that have been made over the past few years, but really a view that we need to see much stronger levels of achievement within the basic education system. We then dealt with matters of health, and their conference called on government to intensify steps toward implementing the national health insurance system. We have the white paper adopted by Cabinet. It's out for public comment. There are proposals around the establishment of an NHI fund, and it was felt that we really need to see government accelerating the concrete steps toward implementation of NHI. In particular, conference felt that the number of pilot sites we have at the moment, several of which have done very well in terms of responding to local primary healthcare needs, that perhaps we need to look at expanding the number of pilot sites as an indication of concrete commitment to advancing our NHI goals. There was also very strong support for the proposal that is out in the public domain of utilizing the medical aid tax rebates as a foundation or basis for the to be established NHI fund. Conference felt this is a proposal that the Health Department and National Treasury should focus upon quite stringently and concretely act on. We then, in higher education, discussed the need and agreed on us having to really work more closely through the Department of Higher Education and Training with universities to ask an emerging problem of graduate unemployment and of the employment sector expressing a view that students are emerging as graduates with very, very weak or non-existent work-related skills. And so conference felt we need to look at how we incorporate improved understanding and teaching of work-related skills as preparation either for employment or entrepreneurship. A very strong call on a need to relook at the curriculum structure and what is done and the kinds of skills that graduates are acquiring in our university and college system. With respect to the TVET colleges, strong support for expansion of the sector, for production of more technical and artisan skills in South Africa, and appreciation for what has been announced with respect to support for students within the TVET sector. Also, very, very strong call that government must act speedily to implement the free higher education for young people from poor and working class backgrounds, and also to provide support for families in the middle strata who are unable to meet the full costs of higher education. The conference said that this is something that they would want to see government implementing from 2018, and they welcomed the announcements that had been made by President Zuma with respect to responses to her commission. With respect to health, I've spoken to those matters. There was concern expressed by conference about the work of the HEQC with respect to removing certain degree programs from some higher education institutions. It was clarified that this is a function whose intention is to improve the quality of programs offered, and that once universities meet the required criteria, the Council for Higher Education and the HEQC would then reconfirm their ability to offer these programs. Issues of inequity between rural and urban schools were a strong view reflected by many delegates to conference, particularly the lack of what they say is a systemic program for supporting teachers who work within the rural education sector, and that we really need to improve both incentives and salary schemes in this regard. Finally, there was a proposal about mirroring the ASIDI program in education within the health sector, because you have seen accelerated provision of school infrastructure through the ASIDI program, but that has been in education, and the conference has proposed that this also be an initiative that is introduced within the health sector, because there is dissatisfaction with some of the infrastructure initiatives that should have been implemented in the past few years in the health sector. It hasn't moved as we had hoped, and it was felt you need a specific program targeting the provision of health infrastructure. With that overview then, there is a full report that I'm sure we could make available through you, Zizi. So this is in summary, and we'll try and answer whatever questions are posed.